Hello everyone. In today's video, I'm going to be talking about asthma. Let's start with the definition. Asthma is a chronic inflammatory condition of the airways, that is bronchi and bronchioles, that causes episodic exacerbations of bronchoconstriction. If we look at this picture, you can see that this is the normal airway. The muscles are relaxed, airway wall and the lumen of the airway are of normal caliber. But in asthma, the bronchi, they get hypersensitive to certain triggers like dust, smoke, pets, etc., which causes the muscles to contract, the wall becomes thickened, and there is hypersecretion of the mucus into the lumen, narrowing the lumen. Narrowing of the airways then causes an obstruction to airflow going in and out of the lungs. It isn't clear why some people have asthma and others don't, but it's probably due to a combination of environmental and genetic factors. The bronchoconstriction is caused by hypersensitivity of the airways, and it can be triggered by the following factors. Sulfites and preservatives added to some types of food and beverages, including fish, shrimp, dried fruits, beer and wine, etc. Respiratory infections such as common cold, air pollutants and irritants such as smoke. Airborne substances cause allergy-induced asthma. These include pollen, dust mites, mold spores, pet dander, or particles of cockroach waste. Cold and dry weather, strong emotions and stress can also trigger asthma. Increased physical activity, which is called exercise-induced asthma. And finally, certain medications, including beta blockers, aspirin, ibuprofen, and naproxen, can also trigger an episode of asthma. In asthma, because the airways are narrowed, the patient won't be able to breathe normally. They will have shortness of breath and difficulty in breathing, causing dry cough and chest tightness that is worst at night, along with a high-pitched whistling sound called wheezing. The diagnosis of asthma is based on your clinical judgment. As a doctor, you should be able to differentiate the typical symptoms of asthma from other respiratory conditions. Presentations suggesting a diagnosis of asthma include dry cough with wheeze, shortness of breath, that is typically worse at night, and these symptoms occur in episodes. Also, if there is a history of other atopic conditions such as eczema, hay fever, and food allergies, or if there is a family history of asthma or any other atopic disease. On auscultation of the chest, you will hear bilateral widespread wheeze in asthma. On the other hand, if the patient has dizziness, lightheadedness, peripheral tingling, voice disturbance, or productive cough in the absence of wheeze or breathlessness, then it suggests some other diagnosis. If the patient has a significant smoking history, the physical examination and investigations are repeatedly normal, or if the patient is not responding to treatment, and if there is unilateral focal wheeze, then consider some other diagnosis. Based on your clinical assessment, according to the recent British Thoracic Society and Scottish guidelines, if there is high probability of asthma, then start a trial of treatment and see if it works. If there is intermediate probability of asthma, then perform spirometry first to confirm the diagnosis. And if there is low probability of asthma, then consider a different diagnosis and investigate further. As the guidelines suggest that if there is intermediate probability of asthma, we have to perform spirometry first to confirm the diagnosis. So if the result of spirometry indicate that FEV1 to FVC ratio is less than 70%, then start treating the patient for asthma. But if the ratio is more than 70%, think of another diagnosis and investigate it further. If you remember this graph from our spirometry lectures, then you know that normally when the patient exhales forcefully after a forceful inspiration during spirometry, the curve looks like this. In asthma, however, which is an obstructive lung disease, the curve looks like this instead. It shows that in asthma, the FEV1, which is forced expiratory volume in the first second, is significantly reduced. FVC, which is forced vital capacity, is slightly reduced, and the ratio of FEV1 to FVC is also reduced, that is less than 70%. That's it for today. We will discuss the treatment of asthma in the next lecture, so keep following and don't forget to like and share this video. Take care. God bless you all.